So one thing that people often wonder about in insomnia therapy is what do I do about my sleeping medication? Do I get off of it? Do I continue to take it? How do I navigate both therapy and the use of medication? So in this video, I'm going to talk about the considerations about either stopping treatment or how we might use medication in the context of insomnia therapy. If you don't know me, hi, my name is Dr. Parky. I'm a clinical psychologist and behavioral sleep medicine expert, so I use evidence-based, non-pharmacological, so no medication, in my treatment and approaches to chronic insomnia, and I'm also the author of a self-help book, The Insomnia Paradox. So when I'm working with patients who are using sleep medication before treatment, I usually offer two potential pathways. For patients who are willing and able to get off medication even before starting treatment, this can be a really great pathway to begin with because then allows them to kind of really see where they're currently at without the use of medication and get all the benefits from therapy. On the other hand, some patients are a little bit worried about the use or the misuse of sleeping medication because they've been relying it for so long. They're like, oh my gosh, like what would it be like if I didn't use medication? I won't be able to sleep at all. That's too scary for me. And in which case, it's totally okay to be able to continue using your medication. And what I usually offer to the patients is to make sure that they're using it consistently rather than contingently. So what I mean by using medication consistently rather than contingently, I mean that the patients are using medication at a specific dose each day, or if it's not every day, then it would be sort of at a fixed interval that we've already decided on or collaborated on. So it's every other day or Monday, Wednesday, Friday. So, if we're deciding on a sort of consistent timing, then what days we take it, as well as what time we take it, and what, medication we're taking at what dosage are all going to stay the same. The reason why this is important, number one, is because we want to see the progress that's made in the context of medication being controlled for. Because if sometimes you're taking medication, sometimes you're not taking medication, it's hard to be able to say, oh, am I benefiting from the cognitive behavioral therapy, or am I just benefiting from the use of the medication? And specifically, the contingent use of medication can actually sabotage the gains made in therapy. So let's say you're taking it only on days where you feel like, oh, I really feel the pressure or the need to be able to sleep tonight, so I gotta take my medication. And then they are actually sleeping better because of the medication or because of the psychological effects of reducing anxiety associated with, I've taken my medication, so, I don't have to worry so much before anymore. And that in of itself is going to reduce anxiety and, of course, as a result, improve sleep. And that's actually going to tank our sleep confidence because what we were saying basically is I can't sleep well without the use of my medication. And if I don't take my medication, sleep will not come easily. Moreover, the use of medication in a contingent way can actually sort of reinforce, again, that belief that I'm not able to sleep without my medication and wash away the potential benefits of using, let's say, CBTI. So let's say the first night you were following the strategies really, really well, you were getting out of bed when sleep was not coming, you were waking up at an early time even after a bad night, and the next night, theoretically, you should have more appetite for sleep. However, what you kind of thought in that moment was like, oh my gosh, like I already had a poor night. I can't handle a second poor night, so I gotta take my medication. And then the medication works because in and of itself, it has a physiological and psychological effect, along with the high sleep drive that you built up from the previous night's work. So it almost like confirms this belief that I need my medication to sleep well, otherwise something terrible would have happened, when maybe if you had meant to trust the process of staying consistent on the medication or not using the medication, at least contingently, you would have been able to say, oh, like when I do follow these strategies, I do see some movements and some improvements in my sleep. So when it comes to medication in the context of CBTI, you can absolutely continue the medication, you can get off the medication, but if you do continue on the medication, what I usually ask is for the medication to be taken at a consistent timing so we can really control for this variable and see the impact that insomnia therapy can have on our sleep. And in subsequent videos, I'll also talk about how sleep clinicians like myself help people to taper off their medication over time to make sure that they feel really, really confident that it's their body, it's their sleep systems that are really working, it's not the medication, or that they don't need the medication to be able to sleep well. Thanks for watching as always. Take good care for now. I'll see you next one. Bye bye.